I want to set the record straight on mewing. Among my friend group, there's a lot of misconceptions about what mewing actually is and what it actually does because of the whole brain rot ordeal. Mewing is the thing that existed for years before the whole brain rot thing rolled along. It's a practice that, when done over the span of years, gradually changes the shape of your face and actually makes real changes to your skull structure. Sharpening the jawline is only one of the things that it does, and it works. I'm living proof that it works. I'll show my progress pictures from January 2023 to now on the screen. Now the hairstyle is definitely a little rough in the old ones, and that might have an effect on my face shape, but if you focus on the jawline, there is a huge difference. A lot of my friends think that mewing is that thing where you suck your cheeks and that. I can't really do it well. That's not what it is at all. It's mainly about the posture of your tongue in your mouth. Your skull has several fissures in it at different locations. The way bone grows in the skull is that it's added in between those fissures. So if you imagine this is a fissure in your skull, basically new bone's getting added in there and it can widen that. One of these fissures is right on the roof of your mouth, okay? And there's actually a dental treatment where they put a sort of retainer in that presses up against that fissure and essentially widens it. It makes your jaw wider, which of course would have an effect on your jawline, and it would make it so that your teeth would fit into place without getting crooked because they're all jammed into your small jaw. And that reminds me of something else. If you look at the skull of an ancient human, they don't have crooked teeth, do they? The reasoning for this is because the foods that they ate were tougher and they had to chew more. And when they chewed on these harder foods, as they were developing, their jaws would develop to be bigger. And therefore, when their teeth grew in, they didn't crowd up and push each other around. They just lined up into place neatly. Now, mewing is essentially doing that dental thing I talked about earlier, where it puts pressure on that fissure on the top of your mouth, except it's free, and you do it with your tongue. Mewing causes legitimate changes to the structure of your face, and they're all positive ones. I'm pretty sure one of the other things that happens over years while mewing is that as the lower part of your face is brought more forward, then a crook in your nose, where your nose goes like that, kind of, would disappear. The thing that causes a crook in the nose is that your lower jaw might have receded and basically pulled down that cartilage with it. Mewing also makes it easier to breathe through your nose. One, because you're supposed to be constantly breathing through your nose, and so your body adapts to that. And two, because the structure has actually changed and those passageways are more open, I guess. I don't know the full details. I'm not a mewing expert. And I'm also not going to try and teach how to mew during this video when the son of the guy who actually invented mewing has a YouTube channel where he covers all of this. I just wanted to make a video that can hopefully clear up some misconceptions about what mewing is and show you that it does actually work. Go on YouTube and search up Dr. Mike Mew. And yes, Mew is his actual last name. You'll find a tutorial that he made about mewing where he also covers the actual processes that occur to your skull structure when you mew. Hopefully this helped clear things up a little bit. It's kind of a shame that the brain rot thing has discredited mewing when it's a healthy and effective practice. But it takes patience and it takes a lot of time. Go find the tutorial from Dr. Mike Mew. I think it's on a channel called Orthotropics. Have a good day or a good night. Hopefully not a good night, because you should not be on your device late at night. Bye.